Uh, Spinal precautions. There's really 3 levels that we have here. We have no worry about a C-spine. We have a potential mechanism, maybe a little discomfort or some reason to make us concerned. And then we have the full, I think we have to put her in spinal motion restrictions. So we have spinal motion restrictions, the worst case scenario, spinal precautions, and then nothing. And most of our patients need nothing nowadays. But I don't know that until I assess her. So if we had someone that had some sort of a mechanism that would make me suspect a neck or back injury, remember that's part of our patient assessment, the initial scene survey, my partner's gonna come up, take a C-spine. He's just gonna hold her head still. And that's all he does at this point until I can assess her. So I would finish the rest of my assessment and make sure the airway's open and clear, there's no major bleeding, no life threats, and all that stuff is taken care of. And now I need to decide whether I want to put her in spinal motion something. So I have to assess that. And the first thing I'm gonna do is I'm gonna come up and I'm just gonna palpate down her neck, and I'm just gonna feel down the spinous process all the way down, and I'm looking for her to tell me if anything hurts. Forward just a little bit, good, good. Anything hurt all the way down?
Am I supposed to say yes or no?
So I just palpate the spine all the way down. And if something hurts, like if I hit a spot, she says, ouch.
Ouch.
And I'm like, okay, at that point in time, we're gonna backboard her, C-collar, all the rest of it. But nothing hurt her there. So the next thing I'm gonna do, remember we have different nervous tracts. So we have one for motor, one for kind of a sharp thing, and then one for a soft touch. So those are like 3 cables or 3 wires that are running through your spinal cord. Actually 3 for each side, so a total of 6. So I need to assess those 3 things. And if those 3 things are intact, then her spine is probably intact. So because of the way the spine could be hurt in different spots, I need to assess her arms and her legs. So I'll come down and I'll start with her hands. And I do it a little bit differently. The first thing I always do is, of course, check my pulses, make sure they're present, and then say, I want you to squeeze my fingers. And I'm just comparing to see if that's equal. If one side is much stronger than the other, then I have to be worried, but that's equal. Then I'm gonna have you pull up with your fingers and push down. Good. Now I'm gonna want you to split your fingers open. No, let me hold them. So you do that side, okay, and then this side. Good, good. And you can hold them, so you're not trying to like and break your fingers, but just to see if she can actually push a little bit of resistance out there. Now, which finger am I touching?
My ring finger.
Ring finger, which hand?
Left hand.
Okay, so I do something where I can just see if she knows that. Now I need to do something that's a fairly light touch. So a lot of times I'll grab like a 4x4, or I'll just do a light, just real soft touch, and see if which hand am I touching.
Right.
Okay, and then I also need to do a bit of a sharp touch. So if I had a pen, I could use a pen, or I just pinch a little bit. And which hand am I pinching?
Left.
Okay, she didn't smack me, so it must not hurt too much. But I need something that's sharp and something that's soft. And then I come down and do that same thing to the feet. So normally I would have the boots come off, and I would check pulses on each side. I would again do the soft, and I'd do the sharp to each foot. And then I have her pull up, like she's pulling, yep, and then press down like you're putting on a gas pedal. Good. Which foot am I touching?
Right.
Okay. And that's my assessment. So far everything has been intact, and there's a few other things I have to look at. Is she under 5? Doesn't look like it to me. Is she over 55? She doesn't look like it to me. So if they're within that range of 5 to 55, I don't have to worry as much about spinal precautions. If they're over 55, we have to be a little more cautious because of osteoporosis. And then I need to look to see if she has any what we call distracting injuries. So does she have like a broken arm that really hurts? Because if something else is really hurting her, then she may not be able to tell me that her neck is hurting. And then I need to determine if she's in her right mind and not intoxicated or having something that might be masking the pain, like too much alcohol or too much of a pain medicine. And there's something I just learned from an athletic trainer that I'm going to start adding to my practice, is I want you to push back, okay? Now push forward, and then I'm going to press down and see if any of that hurt. Okay, now take your head and touch your chest, roll it back, good. And look left and right. If anything hurts, stop, so turn it left and turn it right, good. And if none of that hurts at this point in time, we can clear C-spine. So I don't need to use a C-collar, don't need to do anything else. Now, if maybe she had had just a little bit of discomfort or pain when she moved, I would definitely have a C-collar on. If anything else made me think that she had an injury to her neck or back, so maybe she didn't feel her feet or couldn't feel the sharp point on one side. At that point in time, we have to do full spinal motion restriction, and that is C-collar, board, and blocks. That's our full spinal spinal motion restriction. We can use a spine board to move a patient. So I think one of the scenarios earlier, you'd put them on a board and moved them. At that point, if there wasn't any need for spinal precautions, we can actually take the board out from under them. So if you need to lift them up, move them up off the floor, lift them up from a ditch or something, we can use the backboard to move patients, but we don't leave them on it. So that's how I do my spinal clearance. And if there's nothing that's negative with that, then I can go ahead and clear the spine and you let go. And then we can have her just like lay down on the stretcher or whatever we need to do. So any questions on that?